Hello and welcome to Health in the Heartland, a program dedicated to the health issues that affect you. When sudden illness or injury strikes, deciding where to seek medical treatment can cause additional worry. My guest today will help us decide the difference between urgent care and emergency care. My guests are Jeremy McClain, who's the director of the emergency department at Heartland Memorial Hospital, and Dr. Paula Roy, a physician specializing in emergency services with CareFirst Urgent Care Center. So we're glad you're here both with us today.
Thank you.
Let's start a little bit, Dr. Roy, with maybe the first path or the recommended path of treatment for a person that might have sudden illness or an injury.
Well, primarily you want to start with your primary care provider first. It's always best if you can get in to see your regular physician. They're familiar with your underlying conditions and your medical care, your medications. I think each patient feels more comfortable with their own physician. What's happened most recently, though, Karen, is with the Affordable Care Act, there's a lot of individuals who did not have health care insurance before, so they are trying to establish care with primary care physicians. They don't have a primary care physician. So they call and they can't get in immediately to see that person. That's where urgent care comes in, primarily is to kind of bridge that gap until you can establish care.
So when we talk about the best quality of health that they can with the quick treatment modality, correct?
That's correct.
So you have communication with their primary care provider if they let you know who their primary care provider is, so that there could be that follow-up then too, yes?
Correct, we do. All of our records are maintained in their Heartland Memorial Hospital file. They're scanned in, and most of the physicians have access through their computers to be able to view that online. If not, they can request that and it can be faxed directly to their office with no problem.
Okay. Now, Jeremy, I know you are director of a very large and very busy emergency department. Tell us a little bit about the emergency department at Heartland Memorial.
Well, our emergency department is the third or fourth busiest emergency department in the state of Kentucky. Many people don't realize that we see a lot of folks in our emergency room. Last year we saw right at the 63,000 patients. This year we're kind of slated to see about 68,000 patients, and to kind of give you an idea, per day that's about 180 to 200 patients coming in our door seeking emergency help. So it's quite a bit busy atmosphere, and you know, that's really why we want to educate the community and really you know, tell about the different options you have in the community for urgent care setting or a primary care setting, and if needed to, an emergency care setting.
So I heard you say emergency help, and we've heard Dr. Roy talk a little bit about if they can't get into their primary care provider, which would be where they'd want to seek that treatment, of course, first, if they've established that relationship. And the types of maybe illnesses and or injuries that you might see in an urgent care setting. What's the difference between urgent care and then emergent care as far as an emergency?
Absolutely. So, you know, an emergency situation could be, an example could be chest pain, stroke-like symptoms, shortness of breath. Abdominal pain is a big one. You have a lot of major organs that live within the abdominal cavity. So those are types of things where you would want to seek emergency help, and we just stress that that you call 911 when those types of things come up. You don't drive yourself in. Oddly enough, in our community, 50% of people drive themselves in having major medical problems, and that could be a heart attack or a stroke. So we just urge people to call 911 first, have that ability to see medical personnel at your area in which you're experiencing that symptom.
So we usually hear, I think the difference may be, to clarify a little bit, more life-threatening. Is that correct?
Absolutely, absolutely.
Okay. So the individuals that are in the emergency department, do they have special training for those life-threatening?
Yes, we have a yearly training competency to keep our nurses, our providers up to date on the new and the best techniques to take care of those major illnesses. We are a stroke accredited center by American Heart Association. So we have processes and protocols that we use to take care of those individuals. We are a STEMI certified center, so that means, you know, if you're experiencing a heart attack, the first place that the EMS or the first place that you want to go to is a STEMI center, and the ability to be able to open that artery and give the medications that we need to give as soon as those symptoms start to happen is important. So all of our team is certified or trained in the area to take care of those protocols for those emergent cases.
So I'm kind of hearing chest, abdomen, those types of, I'm sure motor vehicle accidents,
Yes.
different things like that are definitely in the emergency department, whereas if I might be having some upper respiratory, ear infections, sore throat, allergies are common, of course, in our area, and can be to the point where they are very disturbing and can disrupt your day. So
Correct.
that is something that they would then seek in the urgent care center. Is that correct, Dr. Roy?
It is. Spring and fall, we're usually very busy because of allergies. Kentucky is well known for our allergy seasons. Flu season in the wintertime tends to be very busy in the urgent care centers. So we have peaks in volume. So. But yes, that's exactly the types of patients that we would see. And what Jeremy has said is some patients will come to us inappropriately and they get a little bit upset because we do have to send them to the emergency department. It's not because of the personnel or our physicians aren't trained as well. Sometimes it's because we don't have the diagnostic capability. He mentioned abdominal pains. We often have to have a CAT scan to diagnose that. Head injuries would be another one, you know, concussions and things that might need a CAT scan or diagnostic modalities that we just don't have at the urgent care center, and we want to be able to provide that patient with the best possible outcome. So our team will, you know, evaluate them, and if we feel like it's more appropriate for them to be in the emergency department, then we try to send them over there, but that's an extra step. So it's better if they know which conditions should present to which place.
More minor, I guess I should say, and more
Yes,
major.
that's
And that's because you do have the diagnostic services of maybe doing a lab draw and some different things in
We
your
have some.
area. But if it's getting to the point where you really have to investigate a little bit deeper and it's more an emergency situation, that's where they'd be sent on.
That's
right.
correct.
And one of the things I want to mention, Dr. Roy mentioned, you know, that sometimes individuals do show up to the urgent care center is, you know, we have great communication between urgent care center and the ER, so we understand and we know when individuals are coming to us from those facilities. So if it just so happens that you show up in the wrong place and maybe they can't take care of the symptom that you're having, then there is great communication in between our areas that we kind of have a heads up that you're coming in and we know that you're going to arrive.
Ready to go. Ready to care for you. Got the team ready to go.
Yes, yes.
Now, Dr. Roy, as far as hours, what are the hours at CareFirst? They pretty much are there later in the morning, right, opening up, and then on into the latter part of the evening, correct?
That's correct. We try to have some hours so that there'll be some after hours when physician offices are closed, because that's an important time that we can provide a service that's not available elsewhere. So our hours are from 10 in the morning until 9:30 at night. Monday through Saturday. Sundays we come in at 2 and we're there till 9:30 at night.
Right. So that'd be kind of giving that individual that might have that relationship with that primary care provider, we hope, and really encourage everyone to establish that relationship after the age of 18. If they've been going to a pediatrician, make sure they get that primary care provider and then have that relationship for preventative care, but then also the acute care and chronic care that might be throughout their lifetime. But they would have called, tried to get in, maybe they couldn't get in, so that would be a situation that then they would go to the urgent care and go from there. Now, emergency, you stress the 911, so individuals that are coming into the emergency department via ambulance and or you do see people that might be driving themselves in, correct?
That's correct, yeah.
And tell us those individuals that you said chest pain, is that correct?
Yeah, some
for
of the
911?
if you think of the major problems that somebody may have, chest pain, shortness of breath, abdominal pain, weakness, anything that is stroke related, slurred speech, you know, in a geriatric population, weakness and just the subtle symptoms even could lead to a major issue. So I think you have to just really listen to your body and understand, you know, what it's trying to tell you, and if if it's anything that you may think it's a major complication, or if it's something that is just not normal, then yeah, we just stress that first seek help through 911 service. And you know, at emergency room we're open 24/7. So we're here if you need that help.
Well, tell us a little bit about maybe the acute. We hear a word acuity, and maybe for our viewers, explain that to us. When somebody is presenting in the emergency department, and maybe when they explain their signs and symptoms, how is that different if I'm, you know, patient A versus patient B that's coming in with chest pain? Who gets seen first? And we hear a word called triage. Tell us a little bit about that word. So
in any emergency room that you would present in, there's an area or a process called triage. And triage has been around since 1800. It was a French term that was used during their wars, and basically it was a way to sort patients by severity. And we use that process today. So when we have patients present, we need to know, you know, what patients need to be seen immediately, what patients need to be seen within the next hour, or what patients may be able to wait a little bit of time before we get to them. So we use a level triage system called ESI, Emergency Severity Index. And our nurses, our providers are trained on that particular system, and they look for signs and symptoms and even the slight vital sign change to be able to move that patient in the right direction. It's a 5-level system. You know, if you come in, you have something that's non-urgent, maybe clinic related, that's a level 5, where a level 1 would be someone who may be experiencing a heart attack or a stroke. So we are able to sort and place patients in the correct area. That way we're able to take care of them appropriately and have the right plan of their care.
And knowing everybody that's presenting to either urgent care or the emergency department doesn't feel well. I mean, we know they wouldn't be there if they didn't feel well, but it's really looking at who needs that care because of the life-threatening situations in the most immediate need. Now, what age brackets are seen at the urgent care center? All ages?
Pretty much all ages. We're really careful. We start usually at about 3 months, particularly if that infant has had a fever, because that's a time frame where that baby can be septic, which means infection that is overwhelming them, and you don't have a lot of other signs. Their immune system isn't fully developed. So we would typically send that onto the emergency department, but otherwise we see pretty much all ages, yes.
So do we have any tips maybe to keep people out of the emergency department and/or urgent care center? Dr. Roy, we'll start with you.
Well, I think just basically living a good, healthy lifestyle. Once again, you want to establish care with a primary provider. You want to have a yearly annual physical, and that's usually going to include some labs. That's going to detect some conditions that maybe not have been manifested yet. So that primary care provider is going to be monitoring your blood pressure and your sugars and things that are very important. So establish that care. You want to always have an accurate list of your medications and your allergies, and you would need to present that, bring that with you, so that we will know if you're coming in to see us what your primary care provider has, what medications that you might be taking, so that we won't give you something that would interact or that you might be allergic to. But you want to basically live a healthy lifestyle, and that is eating correctly, which includes more fresh fruits and vegetables and grains and less fried foods in our hamburgers and French fries that we all love to have occasionally, but we want to eat that in moderation. And exercise. I think if we do those things, we can modify a lot of the conditions that really cause us some long-term disabilities, such as hypertension, high blood pressure, diabetes. We can kind of control some of those things with better lifestyles.
Well, and I know in both settings you see individuals that might have had what we call accidents. So, and we can't necessarily always know when an accident's going to happen, but hopefully we can take some steps, some safety measures maybe to plan ahead for those. And probably in both incidences we've seen individuals that are what they call the weekend warriors, or trying to get different things done that are out and about. So, you know, I think if we stop for a minute and really assess the whole situation, and not only living the healthy lifestyle, but really looking at some safety measures too, correct?
Yeah, I mean, if you're in a vehicle, you know, wearing your seatbelt is very important. vehicles have, the manufacturers of those vehicles have done a great job to keep the inside of that vehicle safe, but it all depends on whether you're wearing that seatbelt. Riding your bike, or you're just, on anything with 2 wheels, wear a helmet. That will protect your head. And we see motorcycle accidents, we see bike accidents, and many of the folks walk out of our emergency room because they wore that helmet. So, and just being smart about what you're doing. If you're close to a body of water, whether that be a pool or lake, watch your children. Be cognizant of what you're doing around that body of water, and wearing a life jacket if you're at the lake, very important. So.
Well, and I think too, we all live busy lifestyles, and so I know, as parents, when you're cooking, there are those times of the days when you're busier. So, if you're cooking dinner, make sure you know where the kids are so the hand doesn't go on the stove, and just trying to really be a little bit more alert and watch what's going on, and tune your body into knowing what time of day it is, where everybody is, what's going on, and taking those steps. And I know you talked about the car, also car seats for infants are very important too. So we really can't stress that enough. Really don't hold the baby. They may be crying, but really make sure that they're in a safe place and in that car seat locked in too. Any other tips for our viewers as we talk about the difference between urgent care and emergent care?
Just want to stress the importance of listening, to your body, and making sure that you're getting checkups quite often. And if you have experienced an emergency situation, again, we're here to take care of you. We have a well-trained staff and a good facility to come to if you need that treatment. But if not, then seek your urgent care area. Seek the resources that you have in your community as far as primary care goes, and just making that right decision the first time will help your plan of care follow through a little bit better, and will also help others who may be experiencing emergency situations. And so, but the emergency room's here 24/7, so we're ready and available to take care of you.
Well, we've talked, I know Dr. Roy, you talked about healthy living, and so it's really taking a responsibility for your own health, having that partnership with your healthcare provider, and being a wise healthcare consumer, knowing the difference between urgent care and emergent care. So we hope you've learned a little bit today on our episode of Health in the Heartland. I'd like to thank our guests for joining us today. Thank you for being here and sharing this important information with our viewers. If you'd like additional information, you can go to our website at www.hmh.net.